Good morning, student. My name is Priya. My topic is on low temperature vapor sterilization monitoring process. The requirements we need: standard AS5369, Sharpie pen, ball pen, vapor procedure and manual. Objectives: ensure patient safety, verify sterilization performance, detect process failure, comply with standards and guidelines, maintain accurate records, promote continuous improvement. Content: here's some contents. Why the monitoring is being done: as a purpose to ensure that low temperature sterilizer vapor processing under using hydrogen peroxide sterilant concentrate achieves conditions for liquid chemical sterilization, to verify that the process achieves its intended purpose of the sterilizing medical device without causing harm to patients or staff. Scope: SST technicians who have undergone training or process RMDs and have been assessed as compliant in the procedure within Southern Cross Gillies Hospital, or experienced technician who can do that. How to complete the monitoring process for low temperature VPROP sterilization. Detailed description of VPROP sterilizer monitoring protocol, incorporating and focusing on specific actionable steps for the technician in our workplace. Step-by-step VPROP sterilizer monitoring protocol. Preparation and cleaning. Cleaning the sterilizer. Visually inspect the interior of the VPROP sterilizer for any visible debris or residue. Wipe down the interior surface including shelf, wall and door gasket with lint-free cloth tamped with a pre-approved cleaning agent. Ensure the drain and at the bottom of the chamber is clear of any obstruction. Allow the interior to air dry completely with the door slightly ajar before loading. Gather supplies: VPRO biological indicator, chemical indicator, sterilization log sheet, or use the VPRO sterilization cycle record log sheet. Personal PPE gear, gloves and eye protection. Loading the sterilizer. Packaging: ensure all items are properly packaged according to the manufacturer instruction using validated sterilization wrap. Chemical indicator placement: place in a chemical indicator strip inside each package to verify sterile and penetration. BI placement: since you are using the flexible cycle or any cycle daily, include a BI with each cycle load. Place the BI in the most challenging area of the sterilizer, typically in the bottom rack or the center of the load. Loading configuration: do not overload the sterilizer. Follow the manufacturer guidelines for more specific load capacity, typically no more than 75% of chamber volume, and proper spacing item 1 inch to ensure adequate sealant circulation. Selecting and starting the appropriate sterilization cycle based on the types of instrument and material being sterilized. And monitoring: before starting the cycle, double check that the door is properly sealed and the gasket is intact. During the cycle, observe the sterilizer display for any error message or unusual readings. Common errors might include: door ajar indicates the door is not properly sealed. Low hydrogen peroxide concentration indicates insufficient sealant. Cycle abort indicates a cycle interruption due to a cycle malfunctions. Refer to the sterilizer manual for troubleshooting steps. If any error occurs, document any error on the log sheet. Inform the error to the sterilizer team leader and call the company to explain the error on VPROP. Also place an out of service indication. If it's more than one working days, that log the job on the safe hub. Post-cycle monitoring, printout verification. Once the cycle is complete, the vProp sterilizer automatically generates a printout. Check the printout to ensure that all cycle parameters, temperature, pressure, hydrogen peroxide concentration, and date and time are within the validated range of specified in the sterilizer's manual. Document the results on the vProp sterilization cycle record, log sheet, initial and date the printout. If any parameters are outside the validated range, quarantine the load and report the issues. See Section 7, Chemical Inspection. Chemical indicator inspection. After the cycle is immediately check the chemical indicator strips inside each package. Observe the color change on the chemical indicator strips. The chemical indicator strips should change from red to yellow. If the color change is not correct, do not use the instrument in the package. Document this on the log sheet. BI incubation. Remove the BI from the sterilizer. Activate the BI according to the manufacturer instructions, usually by crushing an internal ampoule. BI incubate the BI using a compatible incubator following the BI manufacturing recommendation and incubation time. Examples 55 degrees to 60 degrees for 24 to 48 hours. Routine cleaning and testing. Weekly cleaning every Monday or Tuesday. If Monday is a public holiday, perform a routine cleaning of vProp sterilizer as described in step 1. Warm up and leak rate cycle. After cleaning, run a warm up cycle followed by a leak rate cycle. Document the results of the leak rate test on the log sheet. The leak rate must be within the manufacturer specification. Refer to the vProp manual, and if the leak rate fails once, run another cycle, and if fails again, report to the detail to the company and also to the team leader, and put a ETA time service on the technicians. For arrival, flexible cycle with BI. Following the leak rate cycle, run a flexible cycle within the BI to verify the performance. How to interpret and record results. Log sheet recording. Detail to record. Use the vProp sterilizer record cycle record. Log sheet to record the following details for each cycle: date and time of the cycle, sterilizer ID, cycle number, load content, BI, lot number, and expiry, chemical indicator number and expiry date, incubation start and date and end time, BI pass and fail, printout result pass and fail on parameters check of latest initial, filing log sheet. File the completed log sheet according to our facility policy, typically monthly. Store the log sheet for the duration specified by your facilities policy and regulatory requirements, typically 3 years. Here are the example that shows before and after the sterilization and the paperwork and the printout of the machines. Cycle has been passed, and here's the example of before and after sterilization, but the cycle has been failed, and it also recorded in the paperwork and the printout. Interpreting BI result pass after the incubation period. If the BI shows no color change, typically remains the blue or green depending on the indicator. This indicates a pass. This means the sterilization cycle was effective in killing the bacteria spores. Fail if the BI shows a color change, typically turn yellow. This indicates a failure. This means the sterilization cycle did not kill the bacteria spores and the load is not sterilized. Below is the example of the BI that we have used in our department and pass when the BI is color no change, and control has a color change. Fail when both BI and control has changed the color. Paperwork to record the cycle procedures. What action to do if there is a fail or non compliance results, recording to a file, quarantine, reporting, investigation, under investigation, reviewing the sterilizer maintenance record, checking the calibration of the sterilizer, testing the sterilizer with a new BI, recalling and re-sterilizing items processed since the last successful BI test, complete an incident report from form and submit it to the appropriate department. Non-compliance action required: stop. Immediately stop using the sterilizer. Quarantine all items sterilized since the last successful cycle. Notify, inform relevant staff, sterilizing team leader. Check, review sterilization records, indicators, and load for errors. Assess, identify patients who might be affected and assess infection risk. Retest, fix the issues and retest the sterilizer with indicators. Recall or notify, recall instrument if needed. Notify patient if risk is high. Train, provide more training to staff if needed. Maintain schedule, regular sterilization, sterilize maintenance. Document, keep detailed record of all cycles. Explaining how the protocol meets sterilization industry standards. The protocol meets sterilization industry standards through a combination of direct compliance with standards like AS 5369/2023 and validation alternative method that still adhere to best practice and IFU guidelines. The above protocol aligns with the following standard: AS 5369/2023, reprocessing of reusable medical device, clause 7.4, monitoring of sterilization services, and ISO 17665-1, sterilization of healthcare production, section 6, equipment specific requirement for sterilizer equipment including monitoring and control system. Section 7, sterilization process development and validation, outline the requirements for validating the sterilization process using biological indicator. CDC guidelines for disinfection and sterilization in healthcare facilities. 2008 recommend the use of mechanical, chemical, and biological indicator for sterilization monitoring. Recommends weekly BI testing and BI testing of every load containing an implantable device. Editor note: facility guidelines always adhere to your facility specific policies and procedures for sterilization monitoring, as they may be more stringent than these general guidelines. Sterilizer manual: always consult the sterilizer manuals for detailed instructions and troubleshooting. Training: ensure all personnel operating the sterilizer are properly trained and competent in the performing all steps of sterilization. Regular audits: conduct regular audit of the sterilization process to ensure compliance with policies and procedures. Regular validation: conduct a regular validation of the sterilization process to ensure compliance with policies and procedures. And here are some examples. Thank you, student. Please feel free to ask any question if there is, and also provide me the feedback of the question that you need and the questionnaire that I have provided to you. Thank you very much.